Can you tell us a little bit about what is happening in Malkangiri now?
I have not actually been there. So whatever I know is based on the information that we've got from people who've been working there with the communities. So as of now, the latest report says that there are 300 deaths of children. So this is really a cause for concern, and there have been a lot of opinions going around. From what I can make out, this area has been prone to Japanese encephalitis, and as per the World Health Organization guidelines, any area that is prone to Japanese bee encephalitis, there are strict protocols that the government has to follow. It is the responsibility of the state government. So basically they have to start the process of vaccination of children. There's no other measure that is as effective as vaccination of children. Adults are not at risk because those who have got the disease, it provides a lifetime immunity. But children are at high risk, and there are 4 types of vaccinations that are available. So the state government, if the state health department was functioning effectively, they would have done a house-to-house survey, got the number of children who are at risk, and started the immunization process. And this offers a very good protection, and they could also have done preventive measures in terms of how they deal with the mosquitoes. And the second thing is the nutrition part. So the ICTS has a huge responsibility in looking at how much malnutrition is present in the area and making sure that it's not a huge rocket science that the government has to think of some very high-tech, some very fancy measure. It's as simple as giving the child one hot meal that is balanced and it is prepared with locally available foods, and these guidelines have been there from years. The Indian Academy of Pediatrics has very good guidelines for malnutrition, but clearly these children also had malnutrition. So in the presence of malnutrition and situation where the child is exposed to Japanese bee encephalitis, is quite possible that this has led to this huge outbreak, and I think it would count as an epidemic, although I'm not sure at what cutoff point you call it an epidemic. And at this point there was this expert committee which has gone into the community, and so they are saying that they gave a very objective report, but we are responding to what has been available in the public domain. If they were so concerned that they were being misrepresented, then the expert committee should have released the report. The local activists have asked for the report, and they've been told that you file an RTI if you want the report. So as per the media, the government and the media have taken up the expert report and started starting this propaganda, saying that it's because of plant being eaten by the local community, and attributing encephalopathy to that. It's partly by implication, where they're saying we found toxins in the urine of 5 of the children. So the point is, if a child has been eating those plants, you may find traces of the toxins, but that doesn't mean, scientifically you cannot say that that is a cause of death. There are some very specific studies that you have to do to prove that this seed that the community is eating is cause of death. And you cannot just throw statements without absolute proof, because you are affecting the eating practices of a community. You are commenting in a way that this community is going to get more and more marginalized, because those of people who are outside, who do not understand this, it reinforces a stereotype, saying, oh, these Adivasis, these poor people, they just feed their children whatever they want, they feed toxins. And we are further and further stigmatizing a community that is already struggling on the border without access to even basic facilities which all of us as citizens are constitutionally guaranteed.
Can you tell us about how the state has responded to this outbreak, and how the local media has covered the issue?
So if you look at this whole issue, first of all, the government has not done due diligence, in the sense prevention of Japanese encephalitis is very important. And when there has already been cases that have occurred in the area earlier, the government is only now talking about, oh, we will educate these ignorant tribals, and we have just started training our health professionals, and we have started going house to house, and we are going to immunize. So clearly the machinery has been sleeping till now, and it's only that when everybody started making a big noise about it, they're suddenly waking up to it. So it's important for the state government to acknowledge that a huge lapse has been committed, in the sense that citizens of this country who have a right to health and nutrition have been denied those basic rights. And because of that, this outbreak had occurred. And if you see the media, the expert committee brought out an interim report saying, experts say based on 5 urine samples that it may be encephalopathy. And everybody jumped up, picked up that, and it's like the media is so ready to absolve the government. It's so ready to put the onus on the community. And it's also media being very irresponsible in that what is the role of media in any society? It is to question, it is hold anybody accountable. It doesn't become just a mouthpiece of the government. It doesn't just repeat what makes a government look good. And that is clearly what is happening here. So either media is ignoring all these deaths, either they are minimizing it, and it's just like it's some subheader when you're showing other things, or you're jumping in to blame the community. So it's a very skewed media representation, and the fact that these children were malnourished could have aggravated this condition. So the expert committee can only say that we found this toxin in the urine, but the fact that 32 children have already died of confirmed Japanese encephalitis is something that none of us can ignore. Leave alone 300, even if 32 children have died, it means there's been a failure of the state machinery. And the media is trying to minimize that and saying only 32. The only 32 deaths is not a small number. 32 is not a small number. But now we have 300 deaths, and it's I don't know if it's been confirmed that this JAB encephalitis is negative. But I don't think it's been confirmed that is due to the toxin or due to some plant that the community has been eating for several years. All the expert committee can say is that further studies have to be done to see if there's any association, and they have to factor in malnutrition, they have to factor in Japanese bee encephalitis, and they have to factor in the food that the community is eating. But the way they have, the message has gone out is that only 32 deaths are due to Japanese bee and the rest are likely due to poison, which they don't have any evidence.
So the expert committee headed by a doctor from Vellore CMC has tried to blame kind of put the possibility of blame on the community's diet, and maybe trying to absolve the government also. Do you think this is a systematic issue where governments, doctors from middle class and dominant communities, they tend to mistrust the lifestyle, and they tend to discriminate against the tribal lifestyle and tribal social systems? Have you seen such similar prejudices in Karnataka also?
So first of all, this very notion of expert committee has to be questioned, and there is no transparency in how these committees are being set up, how they're selected. And most often from what we have seen, the experts are people who will sit on the fence, or who will make something like what you're saying, or make statements that will absolve the government, or tending to put the blame on the community. So we have seen that. We have worked quite extensively in Bangalore with urban communities, and it is true that the tendency of these so-called experts is to blame community. So in DJLE, when this child died, the child had malnutrition and pneumonia. The Women and Child Department was saying that it was due to pneumonia, and the Health Department was saying it is due to malnutrition. And ultimately, they said it's because of the mother. And the mother is a poor blind lady, and the onus is put on her. Where there's been no, she's been going regularly to the Anganwadis. Child has not been receiving what the child is entitled to. She's been going regularly to the health department. Again, the health system has failed to diagnose, treat and refer the pneumonia. But it's very convenient, and there's this thing of, oh, these Muslim communities, oh, these Adivasis, oh, these Dalits. There is a sweeping undermining of people's agency, and also the expecting people to fight such systemic biases and prejudices that is put onto them. Like, for example, the struggles that people have just to access their food, just to access their pension, just to access PDS, that is a public distribution system. The Anganwadis are so dysfunctional. The quality of food is so bad in the Anganwadis. The health services don't have basic drugs. They don't have basic staffing staff. They don't have beds, the toilets. There's no drinking water. And when even these basic facilities are being denied to people, it becomes some kind of easy mechanism to say, oh, like what the government in Orissa have said, we are going to educate these ignorant tribals. So once you start classifying communities as ignorant, then you basically devalue everything. What they eat, what they do, whatever they do for themselves becomes somehow inferior. And you feel that you are justified. You feel you are an expert. And the expert comes, flies in, gets flown in for like a day, flies out in 2 days, and just because they have the label of expert, they think that they can just comment on everything, on people's traditional foods, on people's eating patterns, on people's behavior, on whether they love their children, don't love their children. And I think expert committees have a lot of responsibility, first of all, to see whether they classify as experts and what is the meaning of expert. Are you expert in that community? Are you expert in the kind of food that they eat? Or you just randomly come, observe something and fly back, and you're not responsible for any of the consequences? The expert committee, if they felt that the media was falsely representing them, then it is their responsibility to come forward and counter it. They have to come forward and say that this is a misrepresentation of what we have to say. They are not saying that. They're feeling hurt and insulted. And I think one of the doctors who's concerned about this made a statement, and I think she's quite right. The expert committee is responsible for the kind of media propaganda that's going on against the community. They should revisit all their research methodologies and their whatever epidemiological evidence that they are used, and they should apologize to the community for the serious damage that they are causing.